Emergency departments have become a war zone. That's a patient testimonial gathered by the Ontario Liberals and put on display at a campaign event today. As Bonnie Crombie tries to shift the spotlight of the election away from Trump and tariffs and onto hallway health care. She's promising to spend billions to get everyone a family doctor in the province, hike nursing wages, and expand hospitals, and slamming PC leader Doug Ford's record.
He didn't get it done. We know that wait times are twice as bad as they were in 2018. And today, 2.5 million people don't have a family doctor. And there are hour-long waits in our ERs.
Brodie Howlett knows that well. In 2022, he was diagnosed with a heart infection and spent months in and out of ERs.
It was, let's just say emergency rooms of 14, 16, 20 hours, sleeping in the bays as you wait for a room to come up.
Howlett says he's been paying close attention to this provincial election and wants fixing ER waits to become a ballot box question. And so do groups that represent Ontario's doctors, nurses, and hospitals. Emergency physician Dr. Andrew Park says cracks in the healthcare system were amplified coming out of the pandemic, and that is only increasing ER waits.
Our patients are much more complex, they're much sicker, their needs are higher, psychologically, physically, and so we're having a difficult time keeping up with that demand. Then you bring it on the emergency department side, and the waits get longer, tensions rise.
The president of the Ontario Nurses Association says a lack of staffing is a major contributor. Right now, the union is bargaining a new contract with the province. She says Ontario needs thousands more nurses to help cut waits.
Nurses are working shorthanded and in dangerous, chaotic situations, and it's completely avoidable and unacceptable.
The head of the Ontario Hospital Association says he'd welcome a greater focus on reducing ER waits as part of the election debate. Hospitals are making strides to reduce those waits, and he's hopeful that a debate can be solutions-oriented.
The last 2 years, I'd say we look at the public debate and it at times verges on hysterics. That's not doing a thing to improve, to bolster or improve public confidence in the system.
The Liberals aren't alone in making big healthcare spending promises. The NDP say they'll spend $4 billion to connect everyone in the province with a family doctor or a nurse practitioner. The PC say they'll spend $1.9 billion to connect everyone to primary care. And the Greens say they will hire more healthcare workers in every region of the province. But for Howlett, his message to all the parties is simple.
Get together in a room and figure out a 20-year plan to get healthcare back on track.
Shawn, Jeffords, CBC News, Toronto.